Okay, so when we're talking about angina, I want you guys to think of angina as the precursor to the heart attack that is coming. Angina or angina, you guys are going to hear it numerous different ways. Angina is where the supply of oxygen doesn't meet the actual demand of the heart muscle. So the heart is working faster than it's actually getting fed. The big one with this is we're going to find it in our older populations. It's very common in our older males. And this is usually due with pain with activity or any kind of exertion. So the example I'll give you is the little old man that goes out to shovel the snow off of his driveway. He develops chest pain. He goes and he sits down and he stops exerting himself, and that pain goes away 15 to 20 minutes later. Okay. It is under the coronary artery disease. It is a precursor for what we call the big one, also known as the myocardial infarction or the heart attack. People can have angina for a long time before they actually go into a heart attack, but more than likely they will be having a heart attack soon enough. So here's another graphic for you guys. Again, the actual blood flow is reduced due to possibly the arterial sclerosis or the atherosclerosis that came after that. They go outside, they start working, they start exerting themselves. The blood is actually hindered from going to the actual muscle. The muscle actually starts to die off. It's not getting oxygen, it's not getting nutrients, it's not releasing the waste that it's supposed to be, so they develop this pain in our chest. And again, this pain will go away. That's the big thing with angina, okay? The pain does go away with rest, all right? And it could take 15, 20, 30 minutes or so, but the pain will go away. And again, this is just because the blood is not getting to the muscle, so that muscle is becoming hypoxic. And because that muscle is becoming hypoxic, it's not able to get the oxygen it needs, it's not able to get the nutrients it needs, it's not able to eliminate the waste that's building up in that area. So the area of the heart is not able to pump appropriately or effectively in order to help with cardiac output. So we talked about keywords the other day in class, keywords that are going to help you guys on all the exams that you guys take in EMS. This is your Angina OP QRS TU scale, and I'm going to have another one for the AMI, which we're going to talk about here next. But remember, that onset is usually with some sort of exertion or some sort of physical activity. With the provocation, rest will always make the pain better or completely eliminate that pain altogether. The quality could be described as anything. It could be sharp, it could be dull, it could be a throb, it could be a squeeze. It could feel like a squeeze and they're not able to catch their breath because of it. All right, it could be described as many things. Sorry, I had to get some water. Radiation, it can radiate anywhere. It can go to the back, it can go up the jaw, it can go down the arm, it can go any which way, or it could pretty much actually stay in place too if it wanted to. Severity, again, it's the 1 to 10 pain scale. The time is usually 10 minutes to days, and I put days on there because there are some literature that says that angina can be going on for days, depending on how far they are in the actual anginal process. And the U is usually that this has happened to them before. Patients diagnosed with angina, they do know about it. They do know how to treat it. They do know that they need to stop what they're doing and rest for a little bit. And some of these people do carry nitroglycerin. They're prescribed nitroglycerin in order to take on a PRN basis or an as-needed basis. So that when they do feel that pain coming on, they pop one of those pills, and that nitroglycerin actually helps dilates the actual vessels in the coronary arteries in order to help with the actual gas exchange and feeding beyond the point of the narrowing of the vessels. So when we're talking about the myocardial infarction, this is where the actual blood supply to a section of the heart has become completely blocked. So with angina, we had the narrowing of the vessels, which actually started causing pain because the muscle was becoming hypoxic. We weren't able to get all the blood to that area in order to perfuse the cardiac muscle cells. The myocardial infarction, also known as a heart attack, is when we have a complete occlusion. The actual blood supply is completely blocked, and this is where the muscle is really starting to become hypoxic real quick, and it's starting to die off. It's becoming necrotic, and it's becoming necrotic real quick. The heart cells are very sensitive, and they really need their oxygen and nutrients and be able to eliminate that waste in order to keep pumping. I do want to mention that I don't want you guys to get confused. Not everybody that has a heart attack has had angina in the past. Okay, you could just have a heart attack without any signs, right? And that's usually kind of how it happens, unfortunately, for some of us. But it's usually with our older population, specifically our older men. They will have some sort of angina that's going to lead up to the myocardial infarction, also known as a heart attack. Okay, so here's your heart attack OPQRSTU. That onset is usually activity, or they could just be sitting there chilling, and all of a sudden they develop a chest pain. The key with this is that it is a constant chest pain. It doesn't come and go. It is constant, okay? Usually with the provocation, nothing's going to make that pain better or worse. It is constant, okay? The quality, it's usually described as a crushing feeling, a squeezing feeling, or the classic, it feels like there's an elephant sitting on my chest right now. It can go anywhere, specifically with females, okay? Men, it usually goes up the left jaw and down the left arm, and we're going to talk about that here in a sec. But women, they don't read the books, they don't play by the rules. I've had females call 911 for a toothache, and they have had a full-blown heart attack going on. So it just kind of depends on the gender of the patient and any other kind of comorbidities that the patient might have. And we're going to talk about that a little bit more when it comes to the endocrine system and diabetes as well. The severity, it's usually higher on the pain scale. It's usually the worst pain they've ever felt in their life. So like, 8, 9, 10 area. Again, the time could be real quick, or it could be like this pain has been in my chest and it's been constantly getting worse and worse and worse, and now it's like a constant 10. And then again, it may or may not they may have a history of angina. If they do have a history of angina, they usually describe this as this is worse than it is usual for their anginal pain. Or it could be the first time that they're having a heart attack and they've never had any kind of symptoms of angina before that. So we really need to make sure that we're doing a good, thorough history on our patients and throwing in a sample on these as well, so that we can start treating these people pharmacology-wise. Get them to the hospital quickly. And then to make things super cool for you guys at the ENT basic level, we also have what's called the silent MI, or the silent heart attack. These are usually heart attacks that present without chest pain. Okay? This comes with experience. This comes with doing a good history. This comes with actually looking at your patient and looking at their skin color and whatnot, and really kind of focusing on their vital signs, all right? But silent MIs are famous for people older than 70 years old, okay? Patients with diabetes, and women. And let's talk about women again real quick. We're going to talk about the quote-unquote Karens of the world. And I want you to picture in your head, who is Karen? You guys know exactly who Karen is, okay? She's usually white. She's usually a little bit older. She's usually fat, and she's could be possibly even a diabetic, right? When you guys move up to paramedic school, you guys will be taught to be afraid of certain patient demographics, the big one being kiddos, right? Pediatrics are very interesting demographic group, because they can compensate and compensate and compensate. They're sitting there looking at you, having a good time. They might look a little pale. Their vital signs are kind of on that border, and then boom, they crash. They're dead. Okay? But the other ones I want you guys to worry about is the fat, old, diabetic, white female. Okay? Also known as the Karens in the world. When you have diabetes, You don't perceive pain like you would if you didn't. And women already have a huge resistance to pain because they have to give birth, right? Men, we're a bunch of sissies. You know how that is. I can stub my toe, and life is over. Like, this is how I'm going out. I'm about to die, right? It hurts, but women, they're resilient. They can deal with pain much easier than they can with men, than men can, and that's just the way that they're built. And unfortunately, sometimes the way that women can actually deal with pain, it can actually mask a lot of signs and symptoms of numerous disease processes for them. And we just got to be aware of the silent MI on these patients. So again, women, any patient with diabetes, I don't care how old they are, any patient with diabetes, and geriatrics, anybody that's older than 70 years old. Guys, this is a slide that was put together for you by one of my colleagues. I think it's a great slide. I think this is probably the best slide for you guys to use as a study tool, kind of differentiating between, is this an angina attack or is this actually a heart attack? So I'm not going to read this to you guys. You guys can go over this. Anytime you guys see the initials NTG down at the bottom there, that's talking about nitroglycerin. Okay, so make sure that you guys are also starting to look over your nitroglycerin treatment guidelines. And remember, refer to the PowerPoint slides for pharmacology for those. Okay, all you guys need is on that PowerPoint slide for you guys. And yes, make sure that you guys study this for the exam. This is a great slide to help you study, along with the OPQRS to use between angina and myocardial infarction.